The modern healthcare system won't help you heal.
It's designed to keep you sick and dependent on drugs.
If you want to get well, you got to get out of the system.
You found Predictive Health Clinic.
Join us as we get well and stay healthy.
Welcome to the Predictive Health Podcast. My guest today is Dr. Matt Delgado. Matt, welcome to the show. Let's jump right in. What one specific health issue do you wish to address today?
Treating symptoms versus the root cause and what that even means.
Oh, I love that. What got you interested in this particular issue?
Yeah, being a chiropractor, I think most people that come in to a chiropractor's office would be people in pain, but usually it's an acute flare-up of a chronic issue. And that chronic issue many times has been there for, I'd say years, months to years, but usually years. And most people typically don't realize that almost any disease process takes years to develop, but pretty instantaneously we might feel symptoms, and it can lead us to believe that they just came on pretty suddenly.
Let's go to the third question. What's the biggest popular misconception from your perspective about this issue with root cause versus presenting symptoms?
Yeah, I think time is the biggest factor around it. And I think we're so sold on this idea that everything can be fixed, air quotes on that fixed word, because I don't think we're ever broken or fixed when it comes to our health. Our health is really a process, and most any disease process takes time to develop it, and it takes time to correct. And I think to better illustrate that, if you go into any of the treatment rooms in my office, there's a picture of, you probably heard this story, the straw that broke the camel's back.
Yeah.
And the last straw is usually what brings people in, at least to a chiropractor's office, but many times the doctor in general, right? It's, in a chiropractor's office, we might hear things like, I slept wrong last night, so my neck hurts, or I bent down to pick something up and I threw my back out. But it couldn't have been the air quotes. I'm using air quotes because people will say it's a fender bender I was in 10 years ago, but I wasn't injured. The airbags went off. It was a 40-mile-an-hour accident, but I wasn't injured. I wasn't hurt. And what they mean is I didn't have any symptoms at the time.
Right.
And it could have been that. And it couldn't have been sitting at a desk 8 hours a day for the last 10 years. But what it could have been was this pillow. Had to have been the pillow. And I slept wrong. And that pillow is causing my 10 years worth of neck problems.
I think I know the answer to the follow-up question, but I'd love to hear you articulate. What's the truth about this?
Yeah, healing takes time. We were just talking about, you pointing out there's a helmet of a lot of UT football player that I'll take care of in the background here. One of the favorite interactions I have with a UT football guy that came into my office to see me, he says, what I love about this the most is you're not telling me that you have some quick solution for me. He goes, everyone tries to tell you that as a pro athlete, but he goes, I know things take time. You can't see the best trainer in the world. It doesn't matter how good they are. One workout, I don't care who's training you, your biceps are not going to be bigger. It just doesn't work like that. Or one salad, it could be the most amazing chef in the world that prepares this salad. But if you're trying to optimize your health, it doesn't matter who's preparing the salad. It's not going to work like that. So time takes time.
I remember when I had my own health crisis, and it was when I first got serious about alternatives to the typical way of dealing with health issues.
Yeah.
The doctor who ultimately helped me heal, I said to him, how long is this going to take, doc?
Mm-hmm.
And I'll never forget his answer. He said, you didn't get into this overnight. Not going to get out of it overnight.
Great answer. I love your doctor.
Yeah, I get it. Okay. It sounds like to reframe the issue, most health issues are not something that just flared up from whatever the last event was that you happen to remember, but is more likely something that has been developing over time.
Correct. So I think another good example to think of here, and something I'll use in practice with people, is when you think of something like diabetes. Imagine someone who finds out they have diabetes in a doctor's office. If they were to say, it had to have been the blue Skittle that I had last Thursday, because before that blue Skittle, I did not have diabetes. It had to have been that blue Skittle. And we tend to be so short-minded, and myself included with my own health challenges. I'm not immune to it either. I've had plenty of my own times where I've tripped over the truth of, wow, this has been months to years of poor habits in the making. And now my expression of symptoms has come on pretty suddenly. So symptoms are a smart response that tells a deeper story. And usually that deeper story, when we talk about root cause, that's really what we're talking about. And many times it takes a series of questions or an expert to help guide us there, and maybe the right testing too.
Let's go a little deeper. I'm going to deviate a little bit from the script here because I think we're flying slightly higher than I want to. Let's drill down just a little bit. You're a chiropractor, so you tend to work at a specific type of modality that works to resolve these long-term issues. So let's frame your answer inside the context of the type of modalities, healing modalities that you practice. How would you encourage someone that they need to pay attention to? How would somebody recognize I've got a problem developing
Mm-hmm. Great question.
rather than waiting until it's a full-blown issue? If you could address that from the standpoint of chiropractic care.
Yeah, great question. So I'll just take one step back, even what brings most people into a chiropractic office is pain. But usually when we get to the root of it, it's something in the past that they had that wasn't fully resolved injury wise, like what I did air quotes around a fender bender, or lifestyle habits like sitting at a desk. And more of my lens as a chiropractor is the nervous system, the brain and the spinal cord. That's what controls every perception in our body, but also including things like pain and things like tight muscles or the way our body moves, and every organ that functions in our body: digestion, immune system, mood, energy, sleep. These are all things controlled by the nervous system. So some of the early signs that we might look for, I actually made a poster of this and it's on one of my walls in my office, because we're not taught what to look for, or early things that precede pain, early warning signs. So early warning signs that could precede pain, if we're talking more about a physical manifestation of something in our life that's wrong from a chiropractor's lens, could be things like feeling uncomfortable sitting for long periods in certain positions. That's common, but not normal. I'll give you an example.
Huh.
If you fly on an airplane and you feel like you can't get comfortable on an airplane, or you're sitting at a desk and you feel like you can't get comfortable sitting at a desk and you're kind of always fidgeting, or you need a pillow propping you in a certain way, or you just can't quite get comfortable. That's one sign. Feeling of needing to stretch or foam roll multiple times a day. That's common. That's not normal.
Common but not normal. Okay, good.
Common, but not normal. So again, maybe tension between our shoulder blades, our neck feels really tight and really achy, and we feel like we're always needing to stretch it or maybe even pop it. Popping our own neck and back, that can give really good short-term relief, but the detriment in that is it actually creates a new problem: ligament instability and hypermobility. And I know because I used to do it.
Yeah.
No, nobody told me not to do it. And I had sports injuries, and those led to some pretty significant discomfort in my neck. I didn't really know what to do about it. So I was taking, when I was 15 years old, ibuprofen, and I'd pop my own neck, and I got pretty good at popping my own neck. I'd made a lot of noise with it,
Yeah.
but it didn't do anything to help me long term. So I say all those things are things that we can look out for as early detectors or early signs of maybe unhealthy joints in our body or an unhealthy spine.
Okay, so say a listener or viewer recognizes themselves in your description of early warning signs. What's the likely outcome if they fail to take action?
Great question. They're going to have more frequent flare ups. And what I mean by that is bouts of pain where they may wake up and be like, whoa, my neck hurts. I can barely move it. I can barely turn it. And then there's little hacks they can use to get through it. They can take ibuprofen, they can ice it, and most likely those flare ups are going to kind of go away on their own. But if you ignore those long enough, those flare ups will become more frequent in nature and more severe in nature. And if you ignore those long enough, then you're going to tend to develop, a named disease or disorder. And the process that's taking place there that's breaking down is, we call it osteoarthritis, is wear and tear of the joints. It's just signs that your joints are wearing out. And if we choose to not actively do something about it, then they'll wear out. We are most people listening to this probably understand. We can get a new car. There's no problem there if it wears out. We cannot trade our body in past a certain point, and then your only option might be surgery. And surgery for something like osteoarthritis isn't necessarily going to get rid of someone's pain. It's about a coin flip on the effectiveness of it. And some of the potential risk factors are pretty significant when we talk about spinal surgery as well, not to
Yeah.
mention the cost.
Right. So what specific steps can someone who recognizes themselves here take in order to prevent or avoid these undesirable outcomes?
Yep. Doing more, I'd say, most people are drawn to stretches. Stretches are great for quick symptom relief. That's why we're drawn to them, but they don't do much for us long term. More corrective exercise is what I'd recommend, and that's building healthy joints. Corrective exercise or stability exercises are moves that are designed to think of physical therapy type exercises that are designed to help create healthy joints. So that's something that we can do on our own. Taking more frequent breaks also, if we work at a desk or if we're sitting most of the day, we're meant to be moving. So there's no way around that. And someone might say, I have a standing desk. So do I. Then I'm just rotting standing up instead of rotting sitting down. But, we're meant to move. So I'd say those are the two free things that people can do on their own. And I think the third really is seeing a chiropractor. Chiropractors are the specialists when it comes to the spine and the nervous system. And like I said, the nervous system controls literally everything. So it's not just about symptom management, but really bigger picture is health optimization, longevity, and how do we preserve the health of our spine and our nervous system so we can live to 100 like we're meant to.
Yeah. I'm going to deviate a little bit more. Can you point us in a direction of identifying the types of corrective exercises we can do on our own?
Sure. I've built a couple guides.
Oh, hooray.
Yeah. So there's a couple guides. I've got a YouTube channel also. And on my YouTube channel, I link, some of the guides. One of the guides is for people with back pain. And even if you don't have back pain, they're all things that you can do also. And I actually worked remote last year, more on the business than in the business, not as a chiropractor. And I would use these same exercises myself, things like a bird dog or a glute bridge, if you're familiar with those. Those are a couple of them that are in the guide. And it's really just meant to create a healthier spine if you already have a healthy spine. And it's meant to help get rid of pain if you have pain.
Okay, so we can link those in the show notes.
Yeah.
Both the guides and the YouTube channel. Excellent. All right, let's talk about Matt Delgado's practice. What's the best compliment, the nicest compliment that you recall getting as a result of your practice?
That we listen. And this was something that who I'm about to mention here. His name's Brian Eisenberg. He's a friend of both of ours, I believe. And Brian helped me discover that pretty early on through reading. He encouraged me to read my Google reviews. And now we've got maybe, 350 Google reviews. But at the time I had maybe 50. And the trend that I noticed in him was he listens. And I think that's really important because people's story is what really should drive our testing. And they always hold a lot of answers that are important. And it's up to us as a practitioner to hear them and just ask the right questions.
I'm reluctant to hammer people, but I'm also reluctant not to highlight something that is absolutely central to my mission of helping the world get back to a place of health. So I want to highlight what you just said. If your healthcare practitioner is not able to, because of outside constraints, listen to you, or simply doesn't listen to you for whatever reason, that's an early warning sign that you've got a healthcare practitioner who, for whatever reason, is unable to help you heal, for whatever reason, is not practicing the healing arts. So, what
Correct.
Matt just said is huge. The mission of this show is twofold. One, it's to help the world heal, and two, it's to help healthcare practitioners return to practicing the healing arts.
Oh, I love
Okay,
it.
so I'm going to ask the painful question now.
Okay.
What's the most common complaint you get?
Yeah, I got you. That one's not, I don't have to think long for that one, unfortunately. That we don't accept health insurance. And I get it because I have health insurance. I think I pay 500 a month for health insurance. And Jack, I don't use it on any of the providers that I see regularly. I've got it in my back pocket in case of a catastrophe or emergency, but I don't use my own health insurance because I dabble more in the proactive health model. And unfortunately, insurance is not, in our country, is not designed to cover health optimization. It's designed to cover symptom management. And I am not in the business of symptom management. That's where we start. But most people that
Yeah.
stick with us are for health optimization and
So I'm
insurance.
sorry, that's just too good. Repeat what you just said.
I'm not in the business of symptom management. That's where people start is for symptoms, but they stay with us for health optimization. And insurance does not cover health optimization, which is true health. They cover reactive care, which is symptom management. That is why we are one of the sickest countries in the world. We rank, I think, dead last every year in these third-party studies among industrialized countries when it comes to overall health. We make up what of all the entire world, I think we take over half the world's drugs, but we're like 5% of the world's population and we rank dead last. So you do the math. Our whole approach is off. So I'm not going to play the game. I'm not going to play the game. And I get it. It's a pain in the butt. I want to use my insurance too, but I finally just given up and put it in my back pocket. And if it covers something one day, so be it. But that's my card just in case I break a bone.
But the common complaint is you don't take insurance. Yeah.
You get it a
Okay.
lot.
Well,
Yeah.
all right. So the big one, question 9. If you had a single health message you wanted to deliver to the world and you could only use 8 words or less, what would that message be?
Being proactive saves time and money.
That applies to more than just health.
Yes, it does.
Very good. Being proactive saves time and money. All right, we're done. Thank you very much, Matt Delgado. We will post your information in the show notes, but for those who are listening right now, tell us how folks can get a hold of those guides and your YouTube channel.
I'd say Instagram is the best way. Dr. Matt Delgado, DrMattDelgado. You'll find it in my bio. I've got some guides to help with some of the stuff you might be experiencing at home. And there's a lot of health educational videos that can help you get started if you're a beginner. And there's a little more advanced things if you're a little bit further along.
Very good. Thanks so much for being with us. This has been Predictive Health, the podcast. We'll talk to you next time.